What is depression? Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activities. It's also fairly common. The Centers for Disease Control and Prevention, CDC trusted source estimates that 8.1% of American adults ages 20 and over had depression in any given 2-week period from 2013 to 2016. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It can also influence relationships and some chronic health conditions. Conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone. But, if you're feeling down or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition that can get worse without proper treatment. Those who seek treatment often see improvements in symptoms in just a few weeks. Depression symptoms. Depression can be more than a constant state of sadness or feeling blue. Major depression can cause a variety of symptoms. Some affect your mood, and others affect your body. Symptoms may also be ongoing, or come and go. The symptoms of depression can be experienced differently among men, women, and children differently. Men may experience symptoms related to their mood, such as anger, aggressiveness, irritability, anxiousness, restlessness. Emotional well-being, such as feeling empty, sad, hopeless. Behavior, such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, engaging in high-risk activities. Sexual interest, such as reduced sexual desire, lack of sexual performance. Cognitive abilities, such as inability to concentrate, difficulty completing tasks, delayed responses during conversations. Sleep patterns, such as insomnia, restless sleep, excessive sleepiness, not sleeping through the night. Physical well-being, such as fatigue, pains, headache, digestive problems. Women may experience symptoms related to their mood, such as irritability. Emotional well-being, such as feeling sad or empty, anxious or hopeless. Behavior, such as loss of interest in activities, withdrawing from social engagements, thoughts of suicide. Cognitive abilities, such as thinking or talking more slowly. Sleep patterns, such as difficulty sleeping through the night, waking early, sleeping too much. Physical well-being, such as decreased energy, greater fatigue, changes in appetite, weight changes, aches, pain, headaches, increased cramps. Children may experience symptoms related to their mood, such as irritability, anger, mood swings, crying. Emotional well-being, such as feelings of incompetence, for example I can't do anything right, or despair, crying, intense sadness. Behavior, such as getting into trouble at school or refusing to go to school, avoiding friends or siblings, thoughts of death or suicide. Cognitive abilities, such as difficulty concentrating, decline in school performance, changes in grades. Sleep patterns, such as difficulty sleeping or sleeping too much. Physical well-being, such as loss of energy, digestive problems, changes in appetite, weight loss or gain. The symptoms can extend beyond your mind. These 7 physical symptoms of depression prove that depression isn't just all in your head. Depression causes. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include family history. You're at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder, ADHD. Drug use. A history of drug or alcohol misuse can affect your risk. About 21% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical, personal history of mental illness, certain medications, stressful events, such as loss of a loved one, economic problems, or a divorce. Many factors can influence feelings of depression, as well as who develops the condition and who doesn't. The causes of depression are often tied to other elements of your health. However, in many cases, healthcare providers are unable to determine what's causing depression. Depression test. There isn't a single test to diagnose depression. But your healthcare provider can make a diagnosis based on your symptoms and a psychological evaluation. In most cases, they'll ask a series of questions about your moods, appetite, sleep pattern, activity level, thoughts. Because depression can be linked to other health problems, your healthcare provider may also conduct a physical examination and order blood work. Sometimes thyroid problems or a vitamin D deficiency can trigger symptoms of depression. Don't ignore symptoms of depression. If your mood doesn't improve or gets worse, seek medical help. Depression is a serious mental health illness with the potential for complications. If left untreated, complications can include weight gain or loss, physical pain, substance use problems, panic attacks, relationship problems, social isolation, thoughts of suicide, self-harm. Types of depression. Depression can be broken into categories depending on the severity of symptoms. Some people experience mild and temporary episodes, while others experience severe and ongoing depressive episodes. There are two main types: major depressive disorder and persistent depressive disorder. Major depressive disorder. Major depressive disorder is the more severe form of depression. It's characterized by persistent feelings of sadness, hopelessness, and worthlessness that don't go away on their own. In order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a 2-week period. Feeling depressed most of the day. Loss of interest in most regular activities. Significant weight loss or gain. Sleeping a lot or not being able to sleep. Slowed thinking or movement. Fatigue or low energy most days. Feelings of worthlessness or guilt. Loss of concentration or indecisiveness. Recurring thoughts of death or suicide. There are different subtypes of major depressive disorder, which the American Psychiatric Association refers to as specifiers. These include atypical features, anxious distress, mixed features, peripartum onset, during pregnancy or right after giving birth, seasonal patterns, melancholic features, psychotic features, catatonia, persistent depressive disorder. Persistent depressive disorder, PDD, used to be called dysthymia. It's a milder, but chronic, form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. PDD can affect your life more than major depression because it lasts for a longer period. It's common for people with PDD to lose interest in normal daily activities, feel hopeless, lack productivity, have low self-esteem. Depression can be treated successfully, but it's important to stick to your treatment plan. Read more about why depression treatment is important. Treatment for depression. Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your healthcare provider about possible options. The Healthline Find Care tool can provide options in your area if you don't already have a doctor. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatments works best. It's common to combine medical treatments and lifestyle therapies, including the following: medications. Your healthcare provider may prescribe antidepressants, anti-anxiety, antipsychotic medications. Each type of medication that's used to treat depression has benefits and potential risks. Psychotherapy. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Medications. Your healthcare provider may prescribe antidepressants, anti-anxiety, antipsychotic medications. Each type of medication that's used to treat depression has benefits and potential risks. Psychotherapy. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Light therapy. Exposure to doses of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorder, which is now called major depressive disorder with seasonal pattern. Alternative therapies. Ask your healthcare provider about acupuncture or meditation. Some herbal supplements are also used to treat depression, like St. John's wort, same, and fish oil. Talk with your healthcare provider before taking a supplement or combining a supplement with prescription medication because some supplements can react with certain medications. Some supplements may also worsen depression or reduce the effectiveness of medication. Exercise. Aim for 30 minutes of physical activity 3 to 5 days a week. Exercise can increase your body's production of endorphins, which are hormones that improve your mood. Avoid alcohol and drugs. Drinking or misusing drugs may make you feel better for a little bit. But in the long run, these substances can make depression and anxiety symptoms worse. Learn how to say no. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you feel better. Take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoiding negative people, and participating in enjoyable activities. Sometimes depression doesn't respond to medication. Your healthcare provider may recommend other treatment options if your symptoms don't improve. These include electroconvulsive therapy, ECT, or repetitive transcranial magnetic stimulation, RTMS, to treat depression and improve your mood. Natural treatment for depression. Traditional depression treatment uses a combination of prescription medication and counseling. But there are also alternative or complementary treatments you can try. It's important to remember that many of these natural treatments have few studies showing their effects on depression, good or bad. Likewise, the U.S. Food and Drug Administration, FDA, doesn't approve many of the dietary supplements on the market in the United States, so you want to make sure you're buying products from a trustworthy brand. Talk to your healthcare provider before adding supplements to your treatment plan. Supplements. Several types of supplements are thought to have some positive effect on depression symptoms. St. John's wort. Studies are mixed, but this natural treatment is used in Europe as an antidepressant medication. In the United States, it hasn't received the same approval. S-adenosyl L-methionine, same. This compound has shown in limited studies to possibly ease symptoms of depression. The effects were best seen in people taking selective serotonin reuptake inhibitors, SSRIs, a type of traditional antidepressant. 5-hydroxytryptophan, 5-HTP. 5-HTP may raise serotonin levels in the brain, which could ease symptoms. Your body makes this chemical when you consume tryptophan, a protein building block. Omega-3 fatty acids. These essential fats are important to neurological development and brain health. Adding omega-3 supplements to your diet may help reduce depression symptoms. Essential oils. Essential oils are a popular natural remedy for many conditions, but research into their effects on depression is limited. People with depression may find symptom relief with the following essential oils. Wild ginger. Inhaling this strong scent may activate serotonin receptors in your brain. This may slow the release of stress-inducing hormones. Bergamot. This citrusy essential oil has been shown to reduce anxiety in patients awaiting surgery. The same benefit may help individuals who experience anxiety as a result of depression, but there's no research to support that claim. Other oils, such as chamomile or rose oil, may have a calming effect when they're inhaled. Those oils may be beneficial during short-term use. Vitamins. Vitamins are important to many bodily functions. Research suggests 2 vitamins are especially useful for easing symptoms of depression. Vitamin B, B12 and B6 are vital to brain health. When your vitamin B levels are low, your risk for developing depression may be higher. Vitamin D, sometimes called the sunshine vitamin because exposure to the sun supplies it to your body, vitamin D is important for brain, heart, and bone health. People who are depressed are more likely to have low levels of this vitamin. Many herbs, supplements, and vitamins claim to help ease symptoms of depression, but most haven't shown themselves to be effective in clinical research. Learn about herbs, vitamins, and supplements that have shown some promise, and ask your healthcare provider if any are right for you. Advertisement. Online therapy can help with depression. Improve your quality of life with the support of BetterHelp's licensed therapists. Speak to a therapist during a phone or video session and stay connected throughout your day with BetterHelp's messaging platform. Start quiz. Preventing depression. Depression isn't generally considered to be preventable. It's hard to recognize what causes it, which means preventing it is more difficult. But once you've experienced a depressive episode, you may be better prepared to prevent a future episode by learning which lifestyle changes and treatments are helpful. Techniques that may help include regular exercise, getting plenty of sleep, maintaining treatments, reducing stress, building strong relationships with others. Other techniques and ideas may also help you prevent depression. Read the full list of 15 ways you may be able to avoid depression. Bipolar depression. Bipolar depression occurs in certain types of bipolar disorder, when the person experiences a depressive episode. People with bipolar disorder may experience significant mood swings. Episodes in bipolar II, for instance, typically range from manic episodes of high energy to depressive episodes of low energy. This depends on the type of bipolar disorder you have. A diagnosis of bipolar I only has to have the presence of manic episodes, not depression. Symptoms of depression in people with bipolar disorder may include loss of interest or enjoyment from normal activities, feeling sad, worried, anxious, or empty, not having energy or struggling to complete tasks, difficulty with recall or memory, sleeping too much or insomnia, weight gain or weight loss as a result of increased or decreased appetite, contemplating death or suicide. If bipolar disorder is treated, many will experience fewer and less severe symptoms of depression, if they experience depressive episodes. These 7 treatments may help ease symptoms of bipolar depression. Depression and anxiety. Depression and anxiety can occur in a person at the same time. In fact, research has shown that over 70% trusted source of people with depressive disorders also have symptoms of anxiety. Though they're thought to be caused by different things, depression and anxiety can produce several similar symptoms, which can include irritability, difficulty with memory or concentration, sleep problems. The 2 conditions also share some common treatments. Both anxiety and depression can be treated with therapy, like cognitive behavioral therapy. Medication. Alternative therapies, including hypnotherapy. If you think you're experiencing symptoms of either of these conditions, or both of them, make an appointment to talk with your healthcare provider. You can work with them to identify coexisting symptoms of anxiety and depression and how they can be treated. Healthline newsletter. Anxiety and depression management? We're here to help. Managing episodes of anxiety and depression is possible with support. Our newsletter offers helpful techniques from our experts and compassionate personal stories to empower you in your journey. Enter your email. Sign up. Your privacy is important to us. Depression and obsessive compulsive disorder, OCD. Obsessive compulsive disorder, OCD, is a type of anxiety disorder. It causes unwanted and repeated thoughts, urges, and fears, obsessions. These fears cause you to act out repeated behaviors or rituals, compulsions, that you hope will ease the stress caused by the obsessions. People diagnosed with OCD frequently find themselves in a loop of obsessions and compulsions. If you have these behaviors, you may feel isolated because of them. This can lead to withdrawal from friends and social situations, which can increase your risk for depression. It's not uncommon for someone with OCD to also have depression. Having one anxiety disorder can increase your odds for having another. Up to 80% trusted source of people with OCD also have major depression. This dual diagnosis is a concern with children, too. Their compulsive behaviors, which may be first developing at a young age, can make them feel unusual. That can lead to withdrawing from friends and can increase the chance of child developing depression. Depression with psychosis. Some individuals who have been diagnosed with major depression may also have symptoms of another mental disorder called psychosis. When the two conditions occur together, it's known as depressive psychosis. Depressive psychosis causes people to see, hear, believe, or smell things that aren't real. People with the condition may also experience feelings of sadness, hopelessness, and irritability. The combination of the two conditions is particularly dangerous. That's because someone with depressive psychosis may experience delusions that cause them to have thoughts of suicide or to take unusual risks. It's unclear what causes these two conditions or why they can occur together, but treatment can successfully ease symptoms. Treatments include medications and electroconvulsive therapy, ECT. Understanding the risk factors and possible causes can help you be aware of early symptoms. Read more about depressive psychosis, how it's treated, and what healthcare providers understand about why it occurs. Depression in pregnancy. Pregnancy is often an exciting time for people. However, it can still be common for a pregnant woman to experience depression. Symptoms of depression during pregnancy include changes in appetite or eating habits, feeling hopeless, anxiety, losing interest in activities and things you previously enjoyed, persistent sadness, troubles concentrating or remembering, sleep problems, including insomnia or sleeping too much, thoughts of death or suicide. Treatment for depression during pregnancy may focus entirely on talk therapy and other natural treatments. While some women do take antidepressants during their pregnancy, it's not clear which ones are the safest. Your healthcare provider may encourage you to try an alternative option until after the birth of your baby. The risks for depression can continue after the baby arrives. Postpartum depression, which is also called major depressive disorder with peripartum onset, is a serious concern for new mothers. Recognizing the symptoms may help you spot a problem and seek help before it becomes overwhelming. Depression and alcohol. Research has established a link between alcohol use and depression. People who have depression are more likely to misuse alcohol. Out of the 20.2 million U.S. adults who experienced a substance use disorder, about 40% had a co-occurring mental illness. According to a 2012 study, 63.8% trusted source of people who are alcohol dependent have depression. Drinking alcohol frequently can make symptoms of depression worse, and people who have depression are more likely to misuse alcohol or become dependent on it. Outlook for depression. Depression can be temporary, or it can be a long-term challenge. Treatment doesn't always make your depression go away completely. However, treatment often makes symptoms more manageable. Managing symptoms of depression involves finding the right combination of medications and therapies. If one treatment doesn't work, talk with your healthcare provider. They can help you create a different treatment plan that may work better in helping you manage your condition. Advertisement. Try a top-rated app for meditation and sleep. 7 physical symptoms that prove depression is not just in your head. We don't often pair depression with physical pain, but research shows this mental illness can really hurt. Depression hurts. And while we often pair this mental illness with emotional pain like sadness, crying, and feelings of hopelessness, research trusted source shows that depression can manifest as physical pain, too. While we don't often think of depression as physical pain, some cultures do, especially those where it's taboo to openly talk about mental health. For example, in Chinese and Korean cultures, depression is considered a myth. So patients, unaware that physical pain may be a sign of psychological distress, go to doctors to treat their physical symptoms instead of describing depression. But keeping these physical symptoms top of mind is just as important as the emotional effects. For one, it's a great way to keep in check with your body and mind. Physical symptoms can signal when a depressive period is about to begin or clue you into whether or not you may be experiencing depression. On the other hand, physical symptoms demonstrate that depression is, in fact, very real and can be detrimental to our overall well-being. Here are 7 of the most common physical symptoms of depression. 1. Fatigue or consistent lower energy levels. Fatigue is a common symptom of depression. Occasionally we all experience lower energy levels and can feel sluggish in the morning, hoping to stay in bed and watch TV instead of going to work. While we often believe exhaustion stems from stress, depression can also cause fatigue. However, unlike everyday fatigue, depression-related fatigue can also cause concentration problems, feelings of irritability, and apathy. Dr. Maurizio Fava, trusted source, director of the clinical research program at Boston's Massachusetts General Hospital, points out that depressed individuals often experience non-restorative sleep, meaning that they feel sluggish even after getting a full night of rest. However, because many physical illnesses, like infections and viruses, can also cause fatigue, it can be challenging to discern whether or not the exhaustion is related to depression. One way to tell, while everyday fatigue is a sign of this mental illness, other symptoms like sadness, feeling hopeless, and anhedonia, lack of pleasure in day-to-day activities, may also be present when you are depressed. 2. Decreased pain tolerance, aka everything hurts more. Does it ever feel like your nerves are on fire and yet you can't find any physical reason for your pain? As it turns out, depression and pain often coexist. One 2015 study showed a correlation between people who are depressed and decreased pain tolerance, while another study in 2010 showed that pain has a greater impact on people who are depressed. These two symptoms don't have clear cause and effect relationship, but it's important to evaluate them together, especially if your doctor recommends medication. Some research suggests trusted source that using antidepressants may not only help relieve depression, but can also act as an analgesic, combating pain. 2. Decreased pain tolerance, aka everything hurts more. Does it ever feel like your nerves are on fire and yet you can't find any physical reason for your pain? As it turns out, depression and pain often coexist. One 2015 study showed a correlation between people who are depressed and decreased pain tolerance, while another study in 2010 showed that pain has a greater impact on people who are depressed. These two symptoms don't have clear cause and effect relationship, but it's important to evaluate them together, especially if your doctor recommends medication. Some research suggests trusted source that using antidepressants may not only help relieve depression, but can also act as an analgesic, combating pain. 3. Back pain or aching muscles all over. You might feel okay in the morning, but once you're at work or sitting at a school desk, your back starts to hurt. It could be stress, or it could be depression. Although they're often associated with bad posture or injuries, backaches can also be a symptom of psychological distress. A 2017 research study trusted source of 1,013 Canadian university students found a direct association between depression and backaches. Psychologists and psychiatrists have long believed emotional issues can cause chronic aches and pains, but the specifics are still being researched, such as the connection between depression and the body's inflammatory response. Newer studies suggest trusted source that inflammation in the body may have something to do with the neurocircuits in our brain. It's thought that inflammation may interrupt brain signals. Trusted source, and therefore may have a role in depression and how we treat it. 4. Headaches. Almost everyone experiences occasional headaches. They're so common that we often write them off as nothing serious. Stressful work situations, like conflict with a coworker, can even trigger these headaches. However, your headache might not always be induced by stress, especially if you've tolerated your coworker in the past. If you notice a switch to daily headaches, it could be a sign of depression. Unlike excruciating migraine headaches, depression-related headaches don't necessarily impair one's functioning. Described by the National Headache Foundation as tension headaches, this type of head pain may feel like a mild throbbing sensation, especially around the eyebrows. While these headaches are helped by over-the-counter pain medication, they typically reoccur regularly. Sometimes chronic tension headaches can be a symptom of major depressive disorder. However, headaches aren't the only indication that your pain may be psychological. People with depression often experience additional symptoms like sadness, feelings of irritability, and decreased energy. 5. Eye problems or decreasing vision. Do you find that the world looks blurry? While depression may cause the world to look gray and bleak, one 2010 research study in Germany suggests that this mental health concern may actually affect one's eyesight. In that study of 80 people, depressed individuals had difficulty seeing differences in black and white. Known by researchers as contrast perception, this might explain why depression can make the world look hazy. 6. Stomach pain or uneasiness in the abdomen. That sinking feeling in your stomach is one of the most recognizable signs of depression. However, when your abdomen starts to cramp, it's easy to write it off as gas or menstrual pain. Pain that worsens, especially when stress arises, may be a sign of depression. In fact, Harvard Medical School researchers suggest that stomach discomfort like cramps, bloating, and nausea may be a sign of poor mental health. What's the link? According to those Harvard researchers, depression can cause, or be a result of, an inflamed digestive system, with pain that's easily mistaken for illnesses like inflammatory bowel disease or irritable bowel syndrome. Doctors and scientists sometimes refer to the gut as the second brain, because they have found a connection between gut health and mental well-being. Our stomachs are full of good bacteria, and if there's an imbalance of good bacteria, symptoms of anxiety and depression may arise. Eating a balanced diet and taking probiotics can improve one's gut health, which may enhance mood, too, but further research is needed. 7. Digestive problems or irregular bowel schedules. Digestive problems, like constipation and diarrhea, can be embarrassing and uncomfortable. Often caused by food poisoning or gastrointestinal viruses, it's easy to assume that gut discomfort stems from a physical illness. But emotions like sadness, anxiety, and overwhelm can disrupt our digestive tracts. One 2011 study trusted source suggests a link between anxiety, depression, and gastrointestinal pain. Pain is another way your brain communicates. If you feel discomfort identifying and talking about distressing emotions, like sadness, anger, and shame, this could cause feelings to manifest differently in the body. If you're experiencing any of these physical symptoms for a prolonged period of time, make an appointment with your primary care doctor or nurse practitioner. If you don't already have a provider, our Healthline Find Care tool can help you connect to physicians in your area. According to the American Psychological Association, depression is one of the most common mental illnesses, affecting 14.8 million American adults each year. Depression can be caused by a variety of factors, such as genetics, exposure to childhood stress or trauma, and brain chemistry. People with depression often need professional help, like psychotherapy and medication, to fully recover. So at your appointment, if you suspect these physical symptoms might be more than surface level, request to be screened for depression and anxiety. This way your healthcare provider can connect you with the help you need. Staying awake, the surprisingly effective way to treat depression. Using sleep deprivation to lift people out of severe depression may seem counterintuitive, but for some people, it's the only thing that works. Linda Geddes reports. The first sign that something is happening is Angelina's hands. As she chats to the nurse in Italian, she begins to gesticulate, jabbing, molding and circling the air with her fingers. As the minutes pass and Angelina becomes increasingly animated, I notice a musicality to her voice that I'm sure wasn't there earlier. The lines in her forehead seem to be softening, and the pursing and stretching of her lips and the crinkling of her eyes tell me as much about her mental state as any interpreter could. Angelina is coming to life, precisely as my body is beginning to shut down. It's 2 a.m., and we're sat in the brightly lit kitchen of a Milanese psychiatric ward, eating spaghetti. There's a dull ache behind my eyes, and I keep on zoning out, but Angelina won't be going to bed for at least another 17 hours, so I'm steeling myself for a long night. In case I doubted her resolve, Angelina removes her glasses, looks directly at me, and uses her thumbs and forefingers to pull open the wrinkled, gray-tinged skin around her eyes. "Achia purty," she says. Eyes open. This is the second night in 3 that Angelina has been deliberately deprived of sleep. For a person with bipolar disorder who has spent the past 2 years in a deep and crippling depression, it may sound like the last thing she needs, but Angelina, and the doctors treating her, hope it will be her salvation. For 2 decades, Francesco Benedetti, who heads the Psychiatry and Clinical Psychobiology Unit at San Raffaele Hospital in Milan, has been investigating so-called wake therapy, in combination with bright light exposure and lithium, as a means of treating depression where drugs have often failed. As a result, psychiatrists in the USA, the UK and other European countries are starting to take notice, launching variations of it in their own clinics. These chronotherapies seem to work by kickstarting a sluggish biological clock. In doing so, they're also shedding new light on the underlying pathology of depression, and on the function of sleep more generally. Sleep deprivation really has opposite effects in healthy people and those with depression, says Benedetti. If you're healthy and you don't sleep, you'll feel in a bad mood. But if you're depressed, it can prompt an immediate improvement in mood, and in cognitive abilities. But, Benedetti adds, there's a catch: once you go to sleep and catch up on those missed hours of sleep, you'll have a 95% chance of relapse.